First, live, local. This is Fox 12 Now.
Hello, everyone. I'm Greg Nibley. This is Fox 12 Now. Again, appreciate you joining us wherever you found us. Thanks for watching. We're live here every weekday at 1 p.m. Pacific and then throughout the afternoon. This is also the place to come to you for breaking news. If it happens in between our other newscasts, our noon show, and of course our 4 p.m. show, this is where you can come and be up to date with all of that. But right now, we're going to be actually playing an interview. This is an exclusive interview with U.S. Representative Andrea Salinas. That's from Oregon's newly created 6th District. So I actually sat down with Representative Salinas about 6 months ago. This was right when Congress was getting in their new session. I don't know if you remember back then, but it was pretty chaotic. A lot happening there, a lot of delays going on, but we had at that time talked about some of her agendas and the things that she wanted to accomplish during this year. Well, 6 months later, which was yesterday, I actually sat down with her again and went through some updates on where she's at, two of her big things that she's advocating for, the Farm Bill. We talk all about that and what that means for Oregonians, and then also talking about mental health and some of the challenges that I think we all are aware of that come with that. So that's a lot of what we cover during this interview. It's about 20 minutes long, so there's a lot in there. If you are watching on one of our social media channels, feel free to comment, drop in your comments there, discuss amongst yourselves. But I'm going to go ahead and roll that right now. So here it is. This is U.S. Representative Andrea Salinas. Congresswoman Andrea Salinas, it is so good to see you again. It's been about 6 months, I think, since we last talked that you were in here. Congress was just getting into session. Whole lot of turmoil going on with that back then. I'm sure it's much calmer now. Not really, but with that, we were talking about some of the agendas that you had, some of the things you wanted to accomplish this year, and wanted to talk about those and just see where we're at with them. One of the big ones is the Farm Bill and the passing of that. And for everybody who's watching this, I wondered if you could maybe give an overview of some of the big topics that you want the Farm Bill to tackle, and then we'll go into some of the specifics about where we're at with that.
Yeah, so thank you. It's good to be here. The Farm Bill is a process, and the reauthorization of the Farm Bill is something we do every 5 years. So we did it in 2018, it was the last time, and it really spends billions of dollars on supporting our growers, our workers, and nutrition programs. I think what people don't realize a lot of times is how much of the Farm Bill actually comprises nutrition and supplemental nutrition assistance in the bill as a whole. So that is a big piece of this. But in addition to making sure that families have nutritious food on the table, another piece of this is I've been talking to growers and really trying to make sure that we have growers who have the safety nets that they need around disasters and climate change. So making sure that they have disaster assistance and crop insurance. And that's a lot. I kind of want to dig into each one of those things on there, but discussing the bill itself, so you mentioned it's re-upped every 5 years. We're in the 5th year, 2018, the last one. That's right.
What is the deadline for this to be voted on?
Well, it expires at the end of this year. So December 31st is the official bill deadline. Now, a lot of times Congress rolls things over, so there is a chance that if we can't complete it and it passes the House and it still has to pass the Senate as well, and I know they're working on a Farm Bill too. So, and we would have to go to conference. So if it doesn't pass by the 31st, it could get rolled over and we would just extend what is existing law.
So going into each one of these, very important things that you were mentioning there, let's talk about supplemental nutrition, like SNAP, the program, Supplemental Nutrition Assistance Program.
That's right.
Right. Thought I would get it right there. So talking about SNAP, what are some of the big things that have changed since the 2018 bill that you want to be different in this one? Are there specific differences that you're aiming to add into this bill?
Well, we had a pretty big fight over the debt ceiling negotiations, and Republicans really wanted to roll back on some of the, and really it was, I think, an extreme part of the conference, who wanted to roll back on benefits, food benefits to seniors and some of our older Americans. And so there are a number of us who I know, I'm one of them, I basically have said, I cannot take food out of my veterans' mouths right now. Now is not the time to do that when we are still seeing really high food prices, and making sure that we have the networks of providers who provide nutritional food to our kids and our older Americans as well as our veterans. So I really want to hold firm and make sure that we can deliver nutritious food programs, whether it's in schools or through our Meals on Wheels programs or to our veterans who, again, I know are struggling still.
And if this bill isn't passed, some of those benefits could go away.
That is right, yeah.
And you mentioned on the other side of the aisle and bipartisan negotiations. What is your feeling on it so far, as far as at least that part of it? Do you think there's going to be compromise found, or is this something that could push it past that deadline?
I think this is the sticking point, sadly, on this bill. I am actually a ranking member on the forestry subcommittee, and I've spoken with my chairman on kind of what we do around wildfires and conservation and that sort of thing. So I think there's some common ground there. I think there's a lot of other areas for common ground. I think this could be the sticking point that does hold it up a little bit.
Going there, it's something you just mentioned, wildfires and natural disasters. Unfortunately, the term unprecedented event is unfortunately precedented now.
Yes.
We see it so much, whether it's a tropical storm in California or a heat dome here or wildfire smoke, so many different natural disasters, and naturally that does affect farming tremendously. And I wanted to get into that and talking about it from the Oregonian standpoint for Oregon. How have these events affected our farming and our farmers out there?
Oh, it's been catastrophic. I mean, I've met with hops growers, I've met with wine growers, some of our nursery and specialty crops growers, and they are having a hard time. And what's sad is that this farm bill, as I mentioned, is billions of dollars of supplemental funding through, USDA and different rural development programs. So, for infrastructure for some of our rural communities. But a big piece of it is to make sure that these crops, when we do see wildfires and natural disasters, have some sort of safety net. And normally that's through what we call crop insurance. So just like you would have a homeowner's policy, in case of fire or water damage, same kind of thing. However, for these smaller specialty crops, they aren't able to get the policies that they need because the incentives that we put in place right now for those who are writing the policies, the incentive is really to make sure that the premiums are as large as possible under each policyholder. Well, I have a bill out actually that will shift the incentives based on that, to make sure that some of our specialty crops are included in this insurance program.
And right now they're perhaps lacking funding because of some of these issues.
Oh, completely. They're on their own. They typically, what I've been hearing is, after the 2020 disaster, for instance, the heat dome and all the wildfires that we were seeing, a lot of our wine growers didn't have any kind of safety net, so they'd have to take out loans and they'd have to figure out, through their families how they could pull together and band-aid their operations and make sure that they stayed afloat. So, and I'm hearing that again from all kinds of growers, but Oregon is, we have a lot of specialty crops. And so this is an area that I've been hearing a lot about, and I'm really eager to figure out how we change the incentives so that some of these, those who write the policies are incentivized to make sure that we include specialty.
And let's talk about specialty crops really quick, just to understand what that means for maybe somebody who's not in farming. What would quantify as specialty crops here in Oregon?
Yeah, so again, some of our nurseries, so the trees and shrubs that we get to plant, all the beautiful azaleas that we have, blueberries, hazelnuts, our Christmas trees, all of these fall under specialty crops.
And obviously we have a lot of that here in Oregon and in the Northwest in general. So with this increase in insurance or more access to crop insurance, this is something that you want to put into this bill, or was this a separate bill, just to clarify?
It is a separate bill, but I'm working with my chairman to try to get it into this bill and trying to make sure that the voice of the Pacific Northwest, and in particular the 6th Congressional District, is heard on this issue.
And what's the feedback been so far as, in Congress, as far as other members of Congress from maybe other states? Are they receptive to this?
So I think there is going to be pushback. I mean, so as we know, there, soybean, corn, sugar, some of the larger commodity crops, those policies are done year after year. They're really large. The premiums are really large. And so the incentive for the insurance company to write those policies is it's low work but high profit. And so we want to switch that paradigm. So clearly it's going to be a struggle. I'm hoping I get some support from some of my Pacific, even California has some of these larger commodity crops, right, that Oregon and Washington don't necessarily have. So I'm hoping to get some support. I know My chairman, G.T. Thompson, he comes from Pennsylvania. They too have a big specialty crop area. So trying to figure out where around the country we're seeing the lack of crop insurance and trying to get some support from those folks.
And this would be incentivizing the insurance companies to make that more available?
That's right.
Okay. And I guess overall, going back and just looking at the Farm Bill overall too, and to address it for maybe ordinary Oregonians who aren't in the farming industry or may not understand and see a lot of spending going on, which is always something everybody's concerned with. Why do you think that everyone should be concerned that this Farm Bill should pass?
Well, I mean, our entire country depends on it, and we are, we feed the world, right? So it is not, it's an economic development issue for Oregonians. It is making sure that we have our own nutritious food on our plates and on our tables and in our schools, and it's the dollar and the family budget for so many Oregonians. And, we go through the entire supply chain. We think about food, and food is that necessity, and we're a big part of that. We're a big player in that. And so we just need to make sure that Oregon gets its fair share of those subsidies that come out of that.
What could be some of the ramifications if this isn't passed?
So what would happen is we would languish kind of with what was under the 2018 bill, so those same funding levels, those same kinds of programs. We would still see Oregon without any kind of, I think, additional addressing wildfires or addressing this lack of crop insurance and safety nets when we see disasters. And this is all, and we know climate change, like you said, this is the new precedent, and this is not going away, and we need to address it in a meaningful way. And I think this new Farm Bill reauthorization can do that.
Is climate change directly addressed in the bill?
It is through different programs, I would say. It gives farmers and growers as well as workers some of the tools, hopefully available to them to utilize the tools that the federal government can put out for them to succeed.
Let's transition on to one of the other, I know, big agendas that we had talked about at the beginning of this year, and that has to do with mental health awareness, mental health treatment, and everything that goes with that. Could you give everybody just a recap of what it was, that you wanted to, what you really wanted to try to get accomplished this year when we talked back at the beginning?
Yeah, thank you. A few things. I started this, what I called Mental Health Mondays, and so whenever I'm in DC, I try to go on the stump and do a speech on the floor to really reduce stigma, make sure that people know that there are resources available, and make sure that people know that, I am a conduit for any kind of federal legislation or ideas that we should be working on. And so what my staff and I have come up with are some, and on the campaign trail and my 6 months in office, I've been hearing from different constituencies about how much Oregonians really lack access to mental health, and yet what a big problem it really is. And I'm hearing it from workplaces, I'm hearing it from hospital emergency departments where, they see the crisis of mental health challenges right there in the emergency department. We're hearing it from schools and educators. So really so many facets of our life, and I think it's tied directly to the homelessness and our substance use crises as well. So trying to make sure that we're addressing all these prongs, but figuring out where to start. So what we've decided to do is, it's a pretty simple bill that I'll be introducing as soon as we go back, and it will afford people who are Medicare or Medicaid, so our older Americans and those who are lower income, will be able to access 3 behavioral health, mental health appointments at no cost share. So no co-insurance, no deductible, nothing like that. So it gets them in the door. And what this is, it's really a preventative piece. And this is on par, I think, with something that we passed when I was still in the legislature, that provides 3 no-cost share appointments for physical health. And we always talk about this separation of physical and mental health when really it should be one thing, right? We don't detach our brains from our bodies, and they affect each other. And so making sure that people can access those 3 appointments is critical.
And I think that's a key point there. You mentioned the mental, physical health, and I feel like a lot of people are understanding that now, just how all that's connected. But at the same time, I am curious, for the feedback from you, because your district covers both urban areas and very rural areas. Has the feedback about mental health concerns been the same across your district, or are there certain factions that care more or care less about that?
Oh, I would say my rural health area, or my rural areas, are critically underserved. And I just visited Willamette Valley Medical Center yesterday. They're seeing the crisis, in a very small local hospital system that, that really can't afford to see the deluge of problems and crises right there, again, at their footsteps. So making sure that people can access the help that they need before it becomes a crisis is so important. And this is not going to address the whole challenge. Like, we see provider shortages everywhere, and again, relaying it back to my rural health areas, or the rural areas in my district, you know, healthcare access is a problem entirely, but mental health specifically. So it is definitely, I'm seeing a divide between, you know, my you know, more suburban areas, but for sure, it is a problem in the rural areas.
So looking at some of the things that you want to pass, you know, for mental health awareness, and you mentioned increasing access for people on Medicare and Medicaid and having access to that, is there going to be anything that can address the lack of actually qualified mental health workers to help pick up that slack and provide that access?
Oh, absolutely. There are a number of different pieces that I think are needed, and I'm hoping that, you know, as this Congress tries to work together, that we can figure out how to make sure that we are priming the pipeline for providers, that our nursing and mental health schools, our adolescent nurse practitioner psychiatrists and that sort of thing, and our clinical behavioral health therapists, that we actually provide some more funding for reimbursement for folks who go into those fields, right? So when they try to get their graduate degrees and things like that, it's expensive, and it's not a lucrative paying job right now. So, you know, it's hard for kids to come out of school with crushing debt and to be able to go into this kind of work. And at the same time, we can expand the type of services that we provide too. You know, peer support is very popular in some of my rural areas, actually throughout the district, and you know, where it's peer-to-peer help. And we see those services, but yet they don't get reimbursed through Medicaid or Medicare. So they don't get reimbursed from the federal level, so the state has to step in. So I think some of those kinds of programs where they can be really cost effective, we have lower levels of care, but we just need a little bit more support from the federal government. I'm really eager to continue to work on things like that. We know, you know, we're setting up different programs across the state to develop 4-year programs as well, through the Balmer Institute up in the Portland area, but it's not enough. We are short so many thousands of providers right now, and we just need to do more.
And looking at that from the federal level, I mean, obviously you're making this effort here for people in Oregon. Do you feel that mental health treatment, awareness, increasing, you know, the number of workers, just mental health concern in general, is something shared across Congress, or is that a divisive issue?
It is actually something that is shared. You know, I'm part of the Mental Health Caucus, and it is a bipartisan caucus. And, you know, we talk sincerely. We see the problems and the challenges from, you know, adolescents and younger children who are starting to present with their own mental health issues earlier on, all the way to older adults and people, you know, well into their older and what should be considered their golden years. And so, and it's not just in Oregon, it is definitely across the United States. So I do think there is going to be a lot of effort around this issue. We keep talking about it because if we don't address it and we don't really find those upstream solutions, we are going to see a full, you know, a workforce fall out from under us, right? We need to make sure that people are prepared mentally and physically to attend school and to attend work. And so this is an economic development issue for, I think, the entire United States. And, you know, I want to make sure that we continue to be a global leader in so many areas that we, you know, currently have right now.
One other thing that you mentioned there, talking about mental health and also mental health awareness and the concerns that people have for that here in Oregon, but also being tied in with perhaps drug usage and issues, also tied in with homelessness. Do you think there's an approach to tackle all three of those, or do each one of those need to be kind of addressed individually?
I think the more we continue to work on any and all of those areas, we start to make the connections easier, right? Because every time you push on one, it's going to affect the other in some way, shape, or form. So yes, we absolutely need more secure residential facilities, and housing is so important. It's hard to get well if you're unhoused. And so all of these components, but we also need to make sure we have the providers and that we have the people who are holding someone's hand who is seeking help, right? And making sure that we have the drug treatment facilities available. And we know we don't right now. And we are in I think, a big inflection point here in Oregon at the state and our local levels, but as well as nationally at the federal level. But working on all of these pieces is going to be critical.
Is there any one specific law that you would be, or act perhaps, that you would be looking at to pass that could cover all of that?
Not that I know of right now
Okay.
in Congress. Like I said, there are lots of different, I think, piecemeal solutions. And for me, it really is looking at this kind of, let's start figuring out how we get people to say, yes, I need help, and getting them in the pipeline, and then really working on the provider shortages. So making sure that we can get people into this kind of work. And folks have said, like, we need to start talking about it even in our education system earlier on, letting our kids in public schools know that there is a path in the mental health and behavioral health arena.
And that's for them to go into that as a career.
Yes, exactly.
Just a couple more quick questions. We talked about Mental Health Mondays, which is something that you had started at the beginning. What's the feedback been on that so far from Oregonians?
We've actually gotten really positive feedback. I think people appreciate knowing that we're thinking about these issues, that we know about different issues, and whether it's depression or weight challenges or whatever the case might be, and from adolescents to older Americans, loss and grief, and that and I would be remiss if I didn't say we have 988 now up and running, which is a federal program. It's our hotline that anybody can call. It's analogous to like 411. So emergency for mental health, call 988. We have that available now. And what other tools are available? And people just, I think, sometimes are afraid to uncover it, to hear that there's nothing available, which is why I think this bill, in fact, it's called the Hope and Mental Health Wellbeing Act, to give people hope.
Anything else that you've heard from? I know you've been back here for a couple of weeks now. Anything else that you've heard from Oregonians that is a concern of theirs?
Well, I mean, there's still,
There's a lot, but-
workforce challenges seem to be a big one. I've been meeting with folks across the district, and I think making sure, again, that we have people who are ready and willing to work, but a lot of that typically starts with their mental health, having food on the table, and making sure that they're prepared and able to go to work.
Anything else that you'd want Oregonians to know about what you're working on? I mean, we covered a lot right
We
here.
did.
Farm bill, mental health, that there's only so much time in a day, but anything else that you want to let them know that you're working towards?
Wildfire response is another big one. So making sure that we have the boots on the ground. I'm working on a bill. It's bipartisan. It's bicameral. It's to enhance what we already have here in Oregon. There are 3 of them. It's called the Civilian Conservation Centers to address wildfires, and it gives direct hiring authority, a lot more liberties through the U.S. Department of Agriculture's Forest Service, essentially, to hire those folks, the wildland firefighters, and making sure that they have all the tools that they need to do the work that is continuing to grow, sadly, with wildfires here in the Pacific Northwest, certainly here in Oregon, but across the nation.
Yeah, really, we have seen a lot of that. I think everybody's felt the impact of that. Okay, final question. We talked about 6 months ago. Let's look at 6 months in the future. What do you hope you have passed by then?
I hope to have influenced this farm bill in a really positive way for Oregonians. So that is kind of my big #1 goal. I hope to, have some elements that will help farm workers as well as the growers, to make sure that the workers have some kind of safety net. And then again, going back to the crop insurance, making sure that there's something in that farm bill for my specialty crop growers here in the Pacific Northwest. And then if we can move the dial around mental health, I'm happy to, be collaborative and making sure, that again, that we can do something that, my colleagues on the other side of the aisle are in control, but I'm happy to provide input from my constituents and what I'm hearing from my rural, suburban, and urban areas to help the conversation around mental health.
All right, well, Congresswoman, thank you very much for taking some time to talk to us, about everything. Looking forward to maybe in 6 months revisiting and seeing where we're at. And best of luck with everything going on in Washington, D.C.
I would love that. Thank you so much.
All right, so there we go. That was the full interview with Representative Salinas. And again, thanks for tuning in. I'm Greg Nibley. This is Fox 12 Now, so this is our live streaming show. Here from the Fox 12 Oregon headquarters. This is our digital desk. What you see behind me is everybody working on the news. We have our newscast coming up at 4 p.m., but this show is live every weekday at 1 p.m., and I will be back tomorrow with that live programming as well. If you have something that you would like to see, or maybe something that you want to talk about when it comes to the show, send us an email, fox12now@kptv.com. If you haven't noticed, there's a lot of smoke in the air and it's been getting to me. So that's kind of what's going on right there. But nonetheless, really appreciate all of you joining us. We're live on our social media channels. We're live on our website. We're live on our apps. And that is where you can find the show every day. We also cover breaking news. So if something is happening between 1 and 4 p.m., wherever you're watching us right now, that's where you go. And I will be there with up-to-the-minute news covering whatever it is that's happening. So lots of things that we do here with this. There is a new tab on our website at kptv.com. You can go there and watch some of our past interviews. You can also go to our YouTube channel and check out all of our interviews there as well, and segments. We cover a lot of things on Fox 12 now. So it's a wide breadth of different topics that we cover with this. So I want to say again, thank you for joining us. Appreciate you being here. Follow that email address if you have something that you want to send in or maybe a suggestion. Feel free to do so, but I'm going to log off for right now. I'm Greg Nibbler. This is Fox 12 Now.